Hi, everybody. This is Beth from Wellness 360. Sorry they changed the format on me, so I had no idea what I was doing today. So let's talk today about back pain. How about that? So what we're going to do is talk a little bit about what back pain is, where it came from, what we can do about it. So again, my name is Beth. I'm from Wellness 360. I'm also work at Genesee Valley Physical Therapy. And I'm just coming to you because I just want to give you some exercises that you can do at home and a little bit of discussion about back pain and seeing that back pain is the number one reason for disabilities in the United States. I thought this would be a great topic to discuss and learn more about. So 8 out of 10 Americans will suffer from some form of back pain throughout their lifetime. That is huge. So 8 out of 10 people, Americans spend over $50 billion a year on their back, whether it's medications or patches or doctor's visits, surgeries. That is a lot of money to be spent. So let's talk a little bit about where back pain comes from and the different types of back pain. So we could have structural back pain. So structural is more like our posture, how we, where are we at in society? We're at our computers, we're reading books, we're driving, we're always in this forward postured position. So because we're always in that forward postured position, a lot of times we get really tight through the chest, and then the mid back to upper back becomes really elongated. Our head sits forward, and for our head typically weighs about 14 pounds. For every inch that our head sits forward out of its natural postural pattern, it adds an extra 10 pounds to the weight of what those muscles have to hold up against gravity. So think of those people that have that kyphotic curve in their shoulders and they're really hunched down. For every inch that you set forward adds an extra 10 pounds. So just 2 inches alone adds your 14-pound head plus the 20 extra pounds. So you're looking at 34 pounds of muscle or of load that muscle has to hold up through the day. So it's no wonder that you're feeling exhausted because your muscles are working overtime to hold you upright. So what we can do is really take breaks throughout your day, stretch out your chest, pull your hands behind your back, open up that chest. My favorite's the doorway stretch, where you can put your hands up on the doorway and just walk through the door and just open up that chest, do some neck stretches. But sitting for long durations for long periods of time can really cause a lot of upper back pain and neck pain. So we also have scoliosis. Some people are born with scoliosis. We can't correct scoliosis, but what we can do is try to prevent the degrees of the curvatures. So we can stretch out the curve, we can stretch it out, we can strengthen the core. Surgery, there are surgeries and braces that you can wear. But as far as the structural, really focus on your posture. Be aware. If you're driving in a car, take lots and lots of breaks. And again, just stretch. Open up that chest. Okay, let's get to osteoarthritis. So osteoarthritis is one of the most common complaints I see in the PT world. Osteoarthritis can be caused by your age. The older you get, the more likely you are to have osteoarthritis. Smoking can cause arthritis, and it can cause more pain because you're limited oxygen to the muscles and the bones, and it decreases your blood flow. So smoking, regardless of what health we're talking about, smoking, if you're still smoking, trying to find a nice plan to quit smoking would be beneficial in so many areas of your life. Your occupation People that do labor, hard labor jobs, or jobs that you do over and over and over, the same repetition a lot over and over through the day. Genetics does play a role in osteoarthritis and sports injuries. Sports injuries or any injuries, if you've had a fall, maybe a skiing accident, maybe a sporting accident, you tend to gather more osteoarthritis in that joint. So again, repetition, sports injuries, very, very common with sports injuries. Another thing with sports is people that play the same sport all year long. So taking time to kind of switch sports, switch the muscles that you're using so that you're not using the same muscles over and over and over again. So there's a lot of camps and clubs that go on in the summer with your kids. Just try to switch it up a little bit. Try to give them some other angles, some different things that they can work on. Another thing, sitting for long periods of time. This is my administrative assistants that are stuck at their desk, stuck at their computer. You have a double whammy here. You're sitting, blood is not flowing properly. It's not picking up that garbage in those joints and flushing it out. A lot of your fluids are not moving properly. So hydrate, get up and move. So maybe set an alarm or, a 15-minute timer. When the timer goes off, you can get up, you can do a couple stretches and move, because motion provides nutrients to those joints. So the worst thing that you can do when you have osteoarthritis is sit. Sitting just lets everything kind of go stagnant. This is the reason that when you wake up in the morning, those first couple steps can be really uncomfortable. So when you're laying in one position or sitting in one position for a while, you're not moving that fluid, that synovial fluid that gets produced in your joints to cushion those joints, that blood flow, that oxygen flow, everything just kind of lays stagnant. So another name for osteoarthritis is spondylosis. So it's just age-related wear and tear on your vertebrae and your joints. So when we talk about spondylosis, we're just talking about that normal wear and tear of life. So that's why it gets more common as we age, because as we age, our joints are aging with us. We're just like a vehicle. We get rusty too. So now, mind you, some movement is good, but you can also go and tip the scales to the other direction and get back into that arthritic repetitive motions over and over and over again. So if you're feeling a little stiff, you're feeling a little sore, just get up and move around. Yoga is wonderful for osteoarthritis. Walks are great for it. That's why whenever you get moving a little bit, you start to feel a little better. We also have degenerative disc disorder. We get this a lot in PT, people that have a lot of spinal issues, a lot of spinal pain. This is when the disc kind of loses its hydration. It wears down, gravity sets in. So you have this wonderful spine that's like a Jenga. It stacks on top of each other. And as the day goes on, as life goes on, those discs lose height. You know how we shrink as we age? That's just because those discs are losing their hydration. They're wearing down a little bit. Gravity is pulling against you. And then the disc can collapse on top of each other. So we're going to talk a little bit about ways we can kind of reverse this process, kind of support the spine so that you have all of these nerves that come out of your disc. So when these nerves come out of your disc and then gravity's pulling, your posture is poor, you sit all day for your job. So now we have all of these discs that are starting to crush down on each other. So any of the nerves that are in the way there, it can cause an inflammatory response. It can really irritate those nerves. So again, movement will feel great. It will produce the synovial fluid between your joints so that you can get a little more fluid in there. Hydrate, drink lots and lots of water. Another kind of osteoarthritis is called stenosis. I know this runs in my family, but spinal stenosis is kind of the junk that kind of gunks up the inside of our spine. So you have these great vertebrae, and you have these little holes that your spinal column goes through, your spinal cord, and little holes that the nerves come out so they can go out into your body for function. So when those little tiny holes get, when they get kind of crud inside of them from the wear and tear and the arthritis. So as you age and as the joints wear and tear, the junk's got to go somewhere. And so sometimes that kind of waste product ends up in those holes. So you have a nice hole that might be this big, and then with the wear and tear, it shrinks, it shrinks, it shrinks, and then it compresses your nerves, it compresses the spinal column, and can cause a lot of radiating discomfort. So for these osteoarthritic conditions, the stenoses, the spondylosis, the degenerative disc disorder, the best thing to do for these is flexion-based exercises. So that's like forward bending, sitting in a chair, leaning forward. You have this hole that goes all the way down to the center of your vertebrae. So when that hole starts to narrow down, anything that you do that causes extension can really cause that hole to get smaller. So you want that hole to get larger. So anything forward bending. Again, yoga is really great for this because there's a lot of forward bending. Be very cautious though, because there's a lot of contraindications for osteoarthritis. Osteoporosis, not arthritis, for spinal fractures. So when you're doing a lot of these deep forward bends, make sure it's just the spinal stenosis and there's not something else going on. At the very end, we're going to talk about some great core strengthening that I recommend for anyone that has low back pain. So let's move on a little bit to spinal fractures. So you have the spondylosis, which is kind of the natural wear and tear on the joints. And every now and then, the okay, let me say this again. Forget it. I said it perfectly 100 times today, and it's not going to come out right now. Spondylolisthesis. That is the spinal fracture. So when you have that wear and tear in the joint, it's really common for that vertebrae to get a little tiny hairline fracture in it. As long as the vertebrae does not slip, sometimes it won't even cause pain. Sometimes you don't even know it's happened. You have no idea when it's happened. But this kind of thing happens a lot when you have a trauma, a car accident, a fall, when you already have weakened bones. So it's mostly imaging that shows this. When I have a patient that has imaging, they normally don't even realize that they've had a fracture. So that's why they call osteoporosis the silent disease, because a lot of times you don't even realize you have osteoporosis until you've had some kind of diagnosis, a fall or a fracture. You can also get compression fractures. This is kind of when the bone caves in on itself. This is caused a lot by osteoporosis and people taking falls. So if you already have weak bones, I've done quite a few talks on osteoporosis. Having those weak bones, having just one fall can really cause a lot of damage to your vertebrae. Then let's talk a little bit about those lovely little things called bone spurs. Believe it or not, our body is such an amazing thing. So our body develops these bone spurs when we have loss of disc height, or our body is fearful that our spine is going to collapse on each other. It's kind of nature's way of protecting our spine. So those bone spurs are normally caused by wear and tear on the joint or the body protecting an area. So what you can do with that, with the bone spurs, you can stretch. I mean, obviously surgery is always an option, least invasive first. So try PT. Stretch out those muscles, strengthen the area around the spine, kind of remind the body that it's okay, the spine is strong now, that it doesn't need the help from those bone spurs. So this is a great way, the core strengthening, to help decrease the pain and increase the strength of the core so that the spine feels more supported. So spinal instability is another reason for back pain. This is just weakness of those spinal muscles and tendons that it creates increased motion. So our spine should move. It should have motion. But sometimes when our core becomes weak, for all of us that don't do a lot of exercising, for those of us that maybe do more sitting than we should, those little tiny muscles that run up and down the vertebrae, they get weak. They turn to fat. They're not helping to support the spine anymore. And when that happens, we end up with herniated disc, slipped disc, when the jelly-like center of that disc kind of pushes through that tough outer layer, and it gets irritated. So it irritates those nerve roots. It irritates those nerves coming out of the vertebrae. So the one thing I love to give my patients that have this spinal instability is a lot of core work. What's important to me for core work is not just dropping down and doing crunches. Crunches, I'm under the impression crunches are not good for anyone or anything. Nothing like building the muscles that pull those shoulders forward. In life today, we don't need any help with the posture, the forward posture. So I like to build the entire core from the innermost layers out. So your core, what is your core? Your core is your transverse abdominis. It's that band that goes all the way around from your spine to the very front of your belly. It wraps into the aponeurosa, or that connective tissue there in the front. It's what holds us upright. It's what protects our spine, helps us to breathe better, helps us to walk with better posture. It supports the spine. Also the internal and external obliques. They're the little fibers that run cross on the sides of our abdomen. Our pelvic floor, which is a super important muscle. So the pelvic floor, when you stop contracting that, it can really cause a lot of low back pain. So sometimes I have women and men, you have pelvic floors too, that come in, and the very first exercise I give them are Kegels. Those trying to stop the flow of urine, those little tiny motions of pulling that pelvic floor up and in. When that happens, you start to fire your transverse abdominis. You start to fire your multifidi. Your glutes are a really big core muscle. Your iliopsoas, that hip flexor, all of these muscles are really, really important to be strong and balanced, to support the spine, to wrap around that spine, to keep it elevated, to keep those discs from crushing down on each other. They also help with your balance. So another great reason to do core stability is balance. It helps to keep you upright. It helps with your posture. So anytime you have herniated disc, slip disc, any kind of nerve irritation, the worst thing you can do is the forward bending exercises. So these exercises, we're going to do the extension-based exercises, the McKinsey exercises, where you're leaning back and you're arching your back. That is why it's really important to have a PT evaluation prior to doing any exercises for your low back. I have a YouTube link in the description. I've uploaded a video, and I'm going to start to upload some more of different exercises you can do for low back pain. It's really important, though, that you realize that those arthritic conditions are fine to do the forward bends. The herniated slip disc exercises, You don't want to do the forward bends because all that's doing is reinforcing the disc, the slip disc to push back, the herniation. The one way I love to tell people is to be able to self-diagnose is if it hurts, don't do it. It's really that simple. If it hurts, don't do it. You'll always have some discomfort, but chances are at the very end, I'm going to tell you some really safe things that you can do. But I wouldn't do anything too much forward bending or too much extension unless you've been diagnosed. I know that GVPT has some great programs running right now. Even though most of us are quarantined, they are able to get you in for an evaluation. They can do some things online. So that would be a great way to get some ideas of some exercises you can do at home. So this is my favorite part of low back pain. Not that I actually have this dysfunction, and I'm sure a lot of you can share in this pain, but SI joint dysfunction. This can be extremely painful. It's one of my specialties when I'm at work there at GVPT, but the sacrum sits, it's a little triangle bone that sits right at the base of your spine. It sits in between your hip bones. So you have your right hip bone, your sacrum sits in between, and then your left hip bone. It is a strong bone with very little motion, but it does have motion. And it absorbs the shock. So when you put that weight on that right foot, it absorbs that shock. And then the left foot, and it just keeps absorbing shock. The problem is too little motion or too much motion can cause severe inflammation. So too much motion typically is felt in the low back or hips, and sometimes radiates into the groin area. So when there's, why would you have too much motion in that? So that hip joint or that SI joint is really supported by ligaments. The wear and tear of falls and trauma, also having a child, hormones, especially for my adolescents, or my menopausal women, these hormones that are getting released, having children, taking a fall, an injury, repeated stress like labor, my construction workers, my laborers, they have a tendency for those ligaments to stretch. And guess what? When the ligaments stretch, ligaments don't heal. They don't recoil. There's minimal to no blood flow to ligaments. So it's not like a tendon or a muscle where it can kind of rejuvenate itself or heal itself. Tendons, not so much, but muscles definitely. But ligaments, once they're stretched, they're like an old gum band that you throw away. So what do we have to do when the ligaments stretch? You have to build your core strength. If you don't have that transverse abdominis, the multifidi, that strength, your hips or your sacrum's just going to move way too much, causing a lot of rubbing, a lot of catching, and a lot of inflammation. So too little motion. So a sacrum that might be a little stuck. The pain is typically felt on a right side more so, or a left side. That kind of radiates into some sciatic pain. You can tell the difference between sciatic pain and SI joint pain because sciatic pain typically will radiate down to your foot. The SI joint pain is normally one side or the other, and it radiates. If it does radiate, it's normally into the glute or into down to the knee, but it doesn't typically cross the knee joint. It can, but it's not typical. So if you're kind of wondering, where your sciatic's coming from, you'll go to the doctor. The doctor will normally send you to PT, and you come in and you're so upset because you were just diagnosed with sciatica. Sciatica is just, the sciatic nerve is just the nerve that runs down to your foot. Sciatica means a million different things. It's like coming in and saying you have a virus. What virus? It could be any kinds of viruses. So a lot of people that get diagnosed with sciatic nerve pain, it means could be coming from your spine. It could be coming from your glute. It could be coming from that little tiny piriformis muscle that is deep, deep, deep inside of your glutes that likes to squeeze around that sciatic nerve. It can be an impingement somewhere in the hip. There's a lot of places that you can have, and that's the wonderful thing about PT is because we can get in there, diagnose where we feel that's coming from. We can give you some anti-inflammatory ultrasounds, some great stretches to do, and we kind of rebalance your muscles in your back. So pain symptoms for back pain. Pain is really, really important when it comes to back pain when you're talking to a PT, talking to your massage therapist, because pain can tell us a lot about what is going on with you. If it could be dull, achy on one side versus the other. Does it radiate into your groin? Is it in one side of your glute and not the other? Is it sharp? Is it hot? Is it stabbing? Is it just stiff? Does it hurt when you get up and out of a chair? And then after a while, it feels a little bit better. We know that's probably arthritis. You're getting up, the synovial fluid's getting pumped, and you're feeling a little better. I do need you to know that sciatic nerve pain, all of these pains are completely normal. And as you can see, 8 out of 10 Americans have it. So first and foremost, don't freak out when you have back pain. There's normally something that you can get done that's very non-invasive. It's very rare that you actually have to go as far as surgery. But there's a lot of things that can be done right in the comfort of your own home. There's stretches that you can do. There's strengthening that you can do. There's some great pain management clinics around. So don't fret. There's a lot that you can do for low back pain. So let's talk a little bit about that core strength that I was talking about before. So core strength. I like to do all of my core strength and with a neutral spine. So that means from the neck all the way down to the tailbone, that stays nice and straight. So I like to start with some transverse abdominis holds, which is that bearing down feeling in your core, or when you're blowing out a balloon and you get to the very end and you can feel your stomach cinch. If everyone takes their hands right now, puts them in front of them on the table, and press down on the table. Yes, you're going to feel that in your shoulder, but pay attention to your gut. Pay attention to your core area when you push your hands down into the table. That is your transverse abdominis. Do a Kegel. Pull in that pelvic floor. Stop the flow of urine. So pull that pubic bone up and in and hold that for a few seconds. These are going to be the most important muscles when it comes to your low back pain. Sometimes these two exercises and these two exercises alone will solve your back pain. Sometimes it takes more than that. Sometimes we have to rebalance your system. My administrative assistants, my computer techs, when you're sitting all day, that iliopsoas, that muscle deep in your pelvis and into your upper leg and your femur, when you're sitting all day long, that muscle takes a lot of energy to hold in that flexed position. So your body just says, you know what, we're just going to hold it there and we're going to shorten that muscle because we won't have to exert so much energy. So over time, that muscle gets shortened, which starts to put a lot of pull in your pelvis. So if you're sitting, cockeyed or on one side, I have had patients who has their SI joints, and when we really get down to the nitty-gritty, when their SI joint goes out, it's because they're standing with their hip jutted out to the side. So be mindful. Notice the way you're standing. Notice the way you're sitting. I am the worst when it comes to sitting. As of right now, I'm sitting in a position that will take my SI joint out. So I'm going to correct that actually right now. So I sit up over top of my other leg. So I always have one leg tucked underneath of me. Sitting sideways on the couch. When you're leaning and you have your feet up on the couch to the side, think of how that puts your spine. What position is that putting your spine in? So when you're doing, be very mindful of your spine. Where's it at? Is it nice and elongated? Are your shoulders back? Are you sitting up tall? Are your legs crossed? When you're standing, is your hip jutting out to the side? So remember, arthritic conditions, if you're having some discomfort, lean forward, hang your head towards the floor, stand up, do that forward fold bend you do in yoga. Any of those motions feel great. If you know you've been diagnosed with a slip disc, lean back in your chair, roll up a towel and put it at the base of your chair to support your low back. These are all things that can help you when you're sitting for long durations at time. Get a bolster pillow to go behind your back, just to give it a little support where that neutral spine should have that nice little curvature in it. So there's different types of pain. We have mechanical pain. This is like a dull or achy pain. It could be a stinging, it could be a burning pain that moves into one leg or the other, that sciatic nerve. Muscle spasms, pain worsens after prolonged sitting or prolonged standing, difficulty standing up straight, walking, going from that transition of sitting to standing. Then you can have radicular pain. That's like an inflammatory or a compression pain, and it kind of shoots. It's like that sciatic nerve where it starts in the spine, but then it shoots down into your feet. So there's different forms of pain. Again, when you're talking to your doctor or your pain specialist or your PT or your acupuncturist or your chiropractor or your massage therapist, be really expressive in how your pain feels. Let them know what side it's on. Let them know how you're feeling and the type. Be very descriptive with the type of pain, because if you're talking about pain that's radiating down the leg all the way to the foot, we're going to know to start looking at the line of the sciatic nerve. We'll check your glute muscles, your low back, your hamstrings. We'll check all of those muscles out for you. So what can you do at home during this quarantine if you're having low back pain? Number one, keep it a healthy weight. This is a no-brainer. The heavier you are, the more compression your vertebrae have. Having a thicker stomach, think of all that pressure. If it's for every inch that your head sits forward, it's an extra 10 pounds. Think of what that belly's doing to your low back, especially if you're doing a lot of sitting in that iliopsoas, that hip flexor muscles tight. It's pulling that anterior tilt to that pelvis, which is increasing that lordotic curve in your low back, which is increasing all of that pressure on those lower vertebrae. So keep it a really healthy weight. Eat your veggies and fruit. Eat an anti-inflammatory diet or live an anti-inflammatory lifestyle. That doesn't mean take anti-inflammatories. Obviously, take them if you need them and if they're prescribed to you, but eat vegetables and fruits. They're going to help you decrease your inflammation. Strengthen your core. Again, neutral core exercises. Bridging is great. Pelvic tilts are great. Pull that belly button into the spine. Don't forget to breathe. And lift your feet off of the ground an inch or two, nice and slow. As long as you're keeping your spine nice and elongated on the ground, your transverse abdominis is pulled in, you should never have low back pain when you're doing core. On our website, wellness360fitness.com, under the forum section, I have a lot of little videos on core. All of the core that I do is neutral spine. So any of the videos that you watch from me will be safe. Obviously, I've already warned you about the flexion and extension based. And I try really hard to express that in the videos. Most of my videos for yoga are yoga for osteoporosis. So they're very safe for people that are more susceptible to a spine fracture. Avoid smoking. I've said this before, I'll say it again. It decreases your oxygen supply to your muscles. It increases the amount of time, like let's say you were to get a fracture in your spine. It's going to increase the time it takes for that to heal because you're getting a lower blood supply. And what is in our blood supply? All of those wonderful things that heal us is in our blood supply. So if the blood is not getting to your joints, if the blood is not getting to your muscles because of lack of movement or smoking, you're going to have a longer time to heal. So move, move, move. It also slowers those osteoblast production, the cells that build your bone. So smoking will decrease the production of bone health. So just stop smoking if you are, and I'm sure there is plans all over the place to help support you in that process. Sit and stand with really good posture. Shoulders back, chin back. I know it looks really silly to have your chin back. And a lot of the videos that I have that I teach for posture, I have you leaning against a wall, pulling that chin back, giving yourself a double chin, and pushing that head back into the wall. When you're driving in a car, push that chin backwards, push that head into the back of the car seat. Not overpressure. You just need enough to engage the muscles, just to strengthen that those deep cervical muscles. Lifting with proper techniques. Make sure you are squatting. You are not bending at the back to lift anything heavy. Move your feet when you're turning. You should never be rotating with a heavy package. Keep the package against your body. You want the weight as close as you can to your body. These are very simple. You can Google proper techniques. They're everywhere. I have a video on how to complete safe and proper body mechanics and day-to-day task for osteoporosis. Again, you can find that on the YouTube link. And last but not least, move, move, move. Walk, stretch, yoga, Pilates is phenomenal and not easy, might I add. But you want to get the synovial fluid in those vertebrae. You want to produce that fluid. You want to bring the blood flow for healing. You want to walk because that weight bearing not only builds bone, but that weight bearing helps your joints. It forces the water and the molecules to come out of those cartilage discs like sponge. So every time you take a step and that gravity pulls down, it squeezes that cartilage like a sponge, and then it absorbs and squeezes it out, and it just keeps that spine healthy and hydrated. It also triggers a process where the damaged cells and the damaged part of your bones and the damaged part of your spine are broken down and removed through your bloodstream. So it's this beautiful process of ebb and flow, of healing and cleaning and building, but without movement, this doesn't happen. And my number one rule in all the classes I teach at Wellness 360, if it hurts, don't do it. So if you're having pain or discomfort, just stop. Don't do it. Call your PT, call your chiropractor, your acupuncturist. I work very closely with a lot of acupuncturists. I'm a huge fan of acupuncture. Of course, PT is in my bloodline, so that is what I go to first. I am a massage therapist, so I do a lot of massage in my PT work. I'm a firm believer in stretching the muscles, massaging the muscles, and then strengthening the heck out of them. You kind of have to tear down your bad posture habits and then rebuild from a clean slate. So there's other things that you can do for back pain. You can take medications, anti-inflammatory pain medications. Again, I'm not a huge advocate for medications. There is a reason and a purpose for them. I am not knocking them, but use them for their purpose. Those people that wake up and just take 3 ibuprofen or Tylenol just to get out of bed and move in the morning, there's got to be a better way. There's got to be another solution, because they are just eating away at your intestinal lining. And if you've listened to any of my other talks, you realize there's so much going on in that intestinal lining that needs to be in 100% shape. So take them, especially if you're coming to PT. We're going to be exercising. Not having that inflammation makes exercise a lot more tolerable. Now, when we're not in the quarantine, I just shifted my seat again. When we're not in the quarantine, GBPT has a ton of aquatic-based exercises. I teach 2 chair yoga classes a week, modified in a chair, so that you can, it's good for any fitness level. You're going to feel amazing when you leave the yoga classes. And of course, my dear friends, the chiropractors, the massage therapist, the acupuncturist, they are amazing. So, and then surgery. Surgery is always an option. There's some great pain medicine doctors. I know Dr. Namani, Dr. Ng, they were wonderful. I've met them in person. They're wonderful people, and they do great work. So typically what happens if you have back pain, you call the doctor sends you to PT. You may get an x-ray, but unless your insurance is really good, you're going to have to come to PT, and you're going to have to do some exercises, because it's the least invasive thing first. So you'll come to us, hopefully Genesee Valley Physical Therapy, and you get your evaluation. You work for a couple weeks. If we don't make progress, we then send you back to your doctor, and then you might go to a pain management clinic. You might go to a surgeon, depending on what you and your doctor decide. So hopefully this has been helpful. I've thrown a ton of information at you. I hope it wasn't too confusing. I hope you enjoyed. And next week, stay tuned, because I have a special guest coming on with me. We're going to talk all about sleep hygiene and how important sleep is to your health and wellness. But until then, this is Beth from Wellness 360 and GBPT signing out.